Hey guys, this is Dr. Cameron Dennis, physical therapist for Back on Track Therapy and Wellness. And today I wanted to continue my series on knee pain and causes of knee pain by continuing to talk about IT band syndrome. So this is our third installment in this series, and on 2 days ago I went over the anatomy of the knee. Yesterday I went over potential causes of knee pain, specifically IT band syndrome. And today I'm going to talk a little bit about potential fixes for IT band syndrome. So unfortunately there's no do this and you'll be better with any real musculoskeletal conditions, especially IT band syndrome, because it is a little bit more complex, and pain in general is multifactorial anyways. So what I would say is, based on the actual problem that you're having, which you might be able to identify from my video yesterday, some of the examples were poor mobility of the hip muscles, so of the tensor fascia lata here, which attaches to the top of the IT band, the lateral quadriceps, also known as the vastus lateralis, the glute muscles, glute max, and the biceps femoris hamstring muscles. If you have a lot of tightness in there, if you have a lot of increased muscle activity because it's flared up or it's painful, what you need to do is first to calm it down. Okay, so one way that I like to do that is through either using a foam roller, lacrosse balls, or there's other mechanisms for applying pressure and rolling. Dry needling sometimes will work if you can find someone that provides dry needling. But so improving the mobility of the hips is going to be a big help, as it will allow for improved rotation while you're running, and improved alignment in the frontal plane, the sagittal plane, while you're running. As we discussed yesterday, if you have a lot of tightness, potentially you're putting a lot of strain on the outside of the knee, causing that pain. So thank you everybody for watching, by the way. So what you're going to do is you're going to improve mobility through those mechanisms that I talked about. But if that's not your problem, then that's not going to fix the pain. So the next thing to think about is to improve glute strength. Okay, so if you're having IT band issues because of weakness in the glutes or the hamstrings, that's another reason that you might have excessive internal rotation at the hip and increased strain on those structures of the lateral thigh. So by strength training the hamstrings and the glutes, that's another way that you can improve your pain. Now, I would recommend starting at a lower level and working your way up, especially if you're having something that's an IT band that's especially flared up. Because really, if you're doing exercises that are causing your pain to go, to 5, 6, 7 out of 10, while you're doing these exercises, you're probably going to want to back it down just a little bit. Because like I said, we're trying to calm it down and then build it back up. So if you're able to tolerate these exercises and their pain is around a 5 or less, 5 out of 10 or less, typically we say is tolerable for this kind of activity. So improving the mobility of the hip muscles, increasing glute and hamstring strength. And the last thing I wanted to talk about is changing your running mechanics. So a lot of times it isn't actually that you have a physical problem. It's just the fact that running puts a ton of strain on the various structures of the legs. And if you're not properly recovering, or if those tissues are not prepared to tolerate that type of load, then what you're going to have is irritation of the nerves and irritation of the structures in that lateral thigh. So when I say change running mechanics, what do I mean? Well, it depends on what your running looks like. So one thing I would suggest is to set up a camera or have someone film you on a treadmill. Kind of take a look. One thing you can do is you can put that on, you can put it in our group. We can take a look at your running gait and see if there's anything that we can point out that's, obvious. Other ways you can do it is you can go to places, physical therapy clinics. Sometimes we'll do this. Running stores, a lot of times we'll do this. I think sometimes they point out small things that probably aren't as serious, and they make you think that you need to buy this certain kind of shoe to fix it. I don't know that that's always the case, and we can talk about that more in other videos. But in general, there are a few things that you can do that seem to help reduce the strain on the knees and on the IT band itself while running. So the first thing that you can try is to reduce or try to avoid downhill running. So avoid running on hills temporarily. So I'm not saying never run on hills. Okay, that doesn't make any sense. But what you might do is just avoid running on hills for a couple of weeks until the pain starts to subside. Okay, and then as that pain goes away, you're starting to build back up, right? So you'll gradually get back into hill running. But what we know is that running downhill increases the strain on the knee and on the IT band. So the other thing you can do is to increase your step rate. And if you're in my running injury support group, you'll know that I probably have mentioned this probably 100 times. Increasing your step rate to around 180 steps per minute has been shown to reduce strain on the knee and the IT band. So one way that I recommend doing that is getting on a treadmill so that you can really focus in on your cadence. Okay, so basically step rate and running and cadence is just how many steps you're taking in a minute, if that hasn't been obvious already. But what you can do is there's you can either time it and count, which can be tedious, or there's actually a running app called Run Cadence app. It's a I believe it's just on Apple right now. But basically what it does is you can actually film yourself running. It will actually calculate your step rate, and then based on that, it will actually, after that, it will tell you what your step rate is, and then it also has a second feature which will give you a metronome for which you should be stepping. So it will help give you that cue to increase your step rate. And like I said, you don't have to buy that app. I think it's like $1 or something like that. I don't think they have it out on Android yet, but it's made by Chris Johnson, who's very smart physical therapist who specializes in treatment of runners. So, like I said, improving the mobility of your hips through either foam rolling or stretches, and making sure to strengthen through that newly acquired range of motion in the hips. Improving your glute strength and hamstring strength typically will help with IT band syndrome, as well as changing your running mechanics. So I don't necessarily think that everyone needs to do every single one of these things. It's just that IT band syndrome and pain in general has so many factors that it could be. It's really hard to pinpoint what your specific cause of that pain is. But these are just some things, some small things that you can try on your own. Now, if these things don't work, obviously, I would go see either your physician or a physical therapist, or some chiropractors actually have good experience in treating running injuries. So that's what I would suggest if these types of things don't work. And if you do try these out, go ahead and let me know in the group. And I'd love to kind of hear how things are going for you and kind of guide you through any problems you might be having. So once again, this is Dr. Cameron Dennis, physical therapist for Back on Track Therapy and Wellness. On here just talking a little bit about potential fixes for IT band syndrome. So I appreciate you watching, and if you're not already in our running injury support group and you're dealing with running injuries, that's something that I would suggest that you do. So thanks for watching.